How old is Evan? How old is Evan? Oh, there you go. How old is Evan? How old is Evan? 1. Yay! We would go to the doctor for my wife, and they would hand out these pamphlets about postpartum depression, and she would fill it out, and she'd be completely fine, and I'd look at it and go, yeah, a little bit, yeah, a little bit, yeah. So I would be filling it out for myself and realize that some things were happening. There was never a point when I wanted to hit him, because he, at the time, under 1 year old, they don't get it. They're not going to understand why they're getting hit. They're not going to understand what they're doing wrong. Did I feel aggression and have to get stuff out? Yes, of course. But what I would do is just, put him in his crib and kind of walk away and go punch a pillow, or just go in another room and just kind of like scream, or just kind of raise my voice to myself.
Fathers do experience depression during the pregnancy and the postnatal period, and in particular between the 3 and 6 months after a baby is born. Up to perhaps a quarter of all fathers experience depressive symptoms. Some depressive symptoms, not necessarily full-blown depression that would require medical intervention, but certainly some depressive symptoms.
The baby touches and gets acquainted with the breast.
They have benefits. When babies feed,
She reaches the breast, and instinctively the mother assists the baby.
The pervasive feeling of sadness, sometimes even just the crying that goes with it. Problem with sleep, difficulty with appetite, the lack of enjoyment of things that you would normally enjoy. These are quite common and may be present both in mothers and fathers in the same way. Some of the thoughts may be different in terms of being, inadequate mother or inadequate fathers, because the two roles are separate. And fathers tend to have more irritability when they are depressed. Males in general, not fathers, men in general tend to show more irritability. Mothers who are only depressed postnatally, their children still have problems. They usually have more problems, for example, at school and with performances in academic settings. So there are different kind of problems. And again, I think this is because of the unique problem that we have when the mother is depressed during pregnancy and the baby being in utero during the depression.
When you first have the baby and you're not sleeping right, you're not eating right, eventually once that starts to level off and you get enough sleep, enough to eat, you tend to feel a little bit better. Whereas this, it didn't matter, you know, if I did end up getting 7 hours sleep or if I was, you know, working out or doing everything, you still feel that, you know, you still feel that way. Nothing kind of evens out.